Right. Welcome back, everybody, to the brain injury discussion. This is your host, Jay. Today, we are going to talk about brain injury and substance use disorder. When we're talking about this, we're talking about substance use as the diagnosis. We see that there's a link between these two diagnoses, between, diagnosis of brain injury as well as substance use disorder. And we're going to get into why and how to take care of this. So, with that being said, like always, our sources will be in the description below. We'd always encourage people to research the sources. Also, there's also continuing research. Hopefully, this is useful and applicable. We'd also appreciate some feedback in the form of a subscription, a like, and a comment. But with that being said, we have a lot to get into, so let's get started. So, the diagnosis of substance use disorder. Well, it is defined as a recurrent, problematic use of alcohol or drugs causes significant impairment, including health problems. The definition is actually much longer than that, but the main theme of this is that it is recurrent and problematic, and it is the use of alcohol or drugs. And what we see here is that it is an impairment. Now, when you hear about a brain injury diagnosis, you might be thinking of a cognitive impairment or a physical impairment. This can definitely lead to brain injury, leading to an impairment. And so we see that this also includes substances like alcohol, prescription drugs like opioids and benzodiazepines. There's a bunch more there, but those are just two examples, as well as illicit drugs, stuff that is not legally either prescribed to you or stuff that is made and, handed out illicitly. And so that's why we need to take this very seriously. So let's start in with the opioids. Now, I've talked about opioids in a previous video. I would recommend that. But we see that this is commonly used in marginalized groups with low socioeconomic status. Now, you might be asking, Jay, why is this important to know? Well, as a brain injury case manager, you have to know your patient population. You have to know the population of the area you are in. You might see a higher opioid use in a field or an area or a county that has more manual jobs. A great example of this is that if you are in Appalachia and you work in a coal mine, you might see higher opioid use in that county, which means that, okay, maybe they're getting injured more often. The same thing goes with if your county has a lot of factory or manual labor jobs or jobs that have an increased risk of severe painful injury. And so that's something to keep in mind. Know your population if you're a brain injury case manager. And so what we see is that opioid use, there's increased risk factors that also play into it, like mental factors, behavioral factors, and economic status. Like I talked about, economic, know your patient population. Behavioral, okay, maybe there's other things involved. Mental, maybe this is what they know to take. But we do see that this is usually from chronic pain from injuries. Think about if you're working in a coal mine or in a factory or on construction, you're probably going to be likely, higher likelihood of getting injured from doing those jobs than from sitting at a computer or in an office. So know your patient population. There's a lot of secondary neurological effects that affect the cognitive abilities of the person who is using opioids. Again, opioids can lead to a brain injury in the case of an overdose. If you don't breathe for about a minute, your brain cells start dying. And so opioids, when they're overdosed and when they're abused, can lead to brain injury. Also with opioids, we can see a long-term dependency and overdoses are very common. It's unfortunate that it's uncommon, but we do see that, yes, this can be addictive. This can be, unfortunately addictive and easy to overdose. There's a lot of difficulty in addressing and preventing and treating this. And so in the brain injury world, we should be aware that opioid use, when it is abused, can cause brain injury. That hypoxia caused from the slowing and the stopping of the breathing from an overdose causes a brain injury. And we can see how one opioid overdose might lead to brain injury, which might lead to another opioid overdose, and the cycle continues on. And so, ideally, we want to break the cycle when it comes to opioids. We want people to be healthy, happy, and pain free. But That would be a good conversation between someone who is on opioids and their doctor. I do stress that, talk to the doctor about it. So, with that being said, let's continue. Let's talk about alcohol. I know I've talked about it before, but we see that alcohol abuse and brain injury is a bi-directional link, which means that brain injury leads to alcohol abuse, and alcohol abuse can lead to brain injury and vice versa. This is a bi-directional link. If you take anything away from this, substance use disorder usually has a bi-directional link to brain injury. And so this is a risk factor for brain injury. This is a predictor. Think about those communities because alcohol, you don't need a prescription to get. You can find it locally in your local gas station. You can find it locally in your local APC store. It is common, and if you're above the age of 21, you're legally allowed to buy it. And so we see that increased risk factors for alcohol abuse and brain injury are quite prevalent because it is legal over the age of 21. It is readily available. And, you can, it is perfectly legal to buy and purchase and consume. It is illegal to do so while operating motor vehicle, but, this is one of those legality ethical issues. Again, I will say that I do not recommend alcohol to anybody. It's not something I recommend. We also see that it is high incidence with brain injury survivors, specifically the traumatic brain injury survivors. Maybe this is a way of compensating for a post-injury kind of a thing. Maybe a secondary injury. Maybe it's something life struggles. Maybe that brain injury took you out of that job. And so we need to address the root cause of the issue as well as what's currently affecting someone who is using alcohol. But there's even more we need to talk about. Let's continue. Illicit drug use. And by illicit, we mean illegal. We're talking about prescription drugs that were prescribed for someone else that you got. We're talking about, manufactured, unmanufactured substances. Um, Unfortunately, this is kind of common with brain injury, especially traumatic brain injury. But what we find is that this stems from multi-factor pain and multi-cause, similar to smoking and alcohol, but we tend to see that this is a multifaceted kind of a cause here. We see that, okay, maybe the person's in pain, maybe they're depressed, maybe they're under anxiety, maybe who knows what's going on in their life. That's why it's important to know the person and to get to know the person. We also see that there's an increased recent intervention and referral programs. We see that there's a lot of this going on now. So people are starting to take notice that, yes, this is a problem. Even though this is still a problem, unfortunately, there is efforts underway to address these kind of problems. But what we see is that brain injury is a prominent factor in substance use disorder. And so when we take illicit drugs as a topic, we see that this might be something that maybe we can help with. Maybe we can help identify and refer people to programs where, maybe they can get clean. And so we see that if we don't do anything, brain injury and substance use disorder, they multiply each other. You get a brain injury, some people will go to substance use. Some people get substance use, they end up getting a brain injury. Now, I'm not saying they're one will always equal the other. However, statistically speaking, they multiply each other. And that is something dangerous. So we should be working towards addressing these problems, especially in the brain injury world. And so let's talk a little bit more about one of my favorite subjects, the military. And why should I bring up the military in this conversation? Well, post-military service, a lot of people were injured by a use of improvised explosives, which is a lot of brain injury. We see that there's a lot of chronic pain and headaches and depression. Again, those are some of the causes that might lead someone to think, well, maybe if I were to consume this substance, maybe that would mask or take care of the pain temporarily. We also see overprescribing of medication. Think about those opioids. You know, they could be overprescribing them. Maybe they will just say yes to get the patient out of the way, or maybe they're in more pain. Maybe they've grown a tolerance to the pain. And so that overprescribing is very dangerous. And so what we see a lot of is slowed or stagnated recovery, which kind of leads to overprescribing of medication because of the chronic pain, the headaches, and maybe the mental health problems that are going on, which kind of stems from the brain injuries that they would have, gotten in the military from being either forward deployed or in training environments where maybe they fell off a ladder, maybe they were near an explosion, maybe they were in a vehicle when it rolled over. And so, what we definitely see in the military community is there is increased substance use for traumatic brain injury survivors, especially the military. And so, that's why it's important to talk about these things. We shouldn't shy away from this subject because, I mean, I'm biased. I'm a veteran. But I will say that this is something we should talk about. We should talk about um, how to fix or address some of these problems within this community, especially for those who, in this case, as we see here, he's going through therapy probably because he's got a lot of pain in the leg that isn't there, which might lead him to go to substances. We don't want people to go to substances. I'll say this over and over again until I'm blue in the face. Substance use is not the answer. What does this lead me to conclude as a brain injury case manager? Well, brain injury, social economic status, maybe your injury status, maybe you have an injury, they all coexist as multi-directional risk factors when we are doing a new intake. These are things we should be talking about politely, but maybe we should discuss these things. Maybe we should get to know them. Maybe we should try to understand why something is going on, because this can all be multi-directional and multifaceted. It's not just enough to know, we also need to understand. Recovery can be difficult, but it is so worth it. When someone is able to break free from substance use, it is so much better for them, especially in the long run. And so we should think about, how do we address this? Is there any local resources? Is there a place where we can get them the help that they need? Maybe there is something pertaining to the brain injury where maybe they can't tell you about the pain. Again, multi-directional, multifaceted. Usually, when we see substance abuse and brain injury, it's covering up something, most likely the pain. Think about that person on the opioids who continually has to increase dosage because he keeps on gaining the tolerance because it's not actually doing anything for the pain. Maybe they will have a brain injury from overdose. We don't want brain injuries. I like to prevent brain injuries, and I also like to prevent substance use. So that's why we need to understand the why about substance use disorder and brain injury. So in conclusion, let's think about doing a couple of things. Let's prevent substance use disorder and also know and educate. As brain injury case managers, we should be either at least knowing our people, but let's also know everybody. Let's talk about how we can prevent substance use disorder, not just for those with brain injury, but also those without brain injury. Because if substance use disorder is one of those factors that can lead to brain injury. And so let's know and let's educate. But with that being said, I believe that will conclude it for this episode. Here are my resources. I would highly encourage you read them. They're very interesting. They're also very sobering in a sense. You start to see that, this is something that we can work with. This is something we can work on. And so we would appreciate you to look up these sources, but we'd also appreciate some feedback. Feel free to comment down below. We'd appreciate if you give this video a like. Maybe we did a good job explaining why substance use disorder and brain injury are kind of linked. We'd also appreciate if you subscribe to the channel so you can continue to learn. We put out this information weekly to learn about brain injury and the many multifaceted things about it. But with that being said, I hope everyone has a wonderful day, and don't forget, protect those brains.